Good morning, everyone, and thank you for joining us today for our seminar on cardiac rehabilitation and heart health. My name is Debbie Cooper. I'm an accredited exercise physiologist and I supervise the heart health and diabetes care program at HFRC. So today we're going to have just a little bit of a chat about heart health and in particular heart disease and the conditions that contribute to that. We'll also look at how we move forward from that and the impact or relevance that cardiac rehabilitation has. So the human heart is truly an incredible machine. It is the most dependable pump ever. Did you also know that it was a muscle? So like all other muscles in the body, we need to keep them nice and strong and healthy to allow it to do the job that it's designed for. So the average heart beats approximately 70 times per minute. So it could be anywhere between 60 to 100 we usually see, but mostly around 70 beats per minute. So that works out to be about 100,000 times each day, more than 36 million beats per year, and over 3 billion times in a lifetime. So it's got to be an amazing machine and kept really healthy to be able to do that. So we have some more fun facts about the heart. Newborn babies have the fastest heartbeats. A woman's heart beats slightly faster than a man's. Your heart beats, as we said, between 100 and 115,000 times a day. The average heart is about the size of a fist. So if you just make a fist with your hand, you'll get a fair idea of how big your heart is. More heart attacks occur on a Monday, and I can only assume that that's maybe following a very busy or big weekend. However, Christmas Day is the most common day for heart attacks to occur. And I'm sure most people have had some sort of stress on Christmas Day at some stage. Men and women can have different heart attack symptoms. So often both will receive that, might have that crushing chest pain, particularly what we see in movies or in videos. But women can also feel very nauseous, have some shortness of breath, be a bit dizzy, and have some pain in their upper back region near their shoulder blades. So a broken heart can actually feel like a heart attack. And laughter really is good for your heart as it reduces stress and boosts your immune system. So it's really important to try and laugh at least once a day. So what is heart disease? Okay, so heart disease is a catch-all phrase or an umbrella term for a variety of conditions that affect or impact on the heart structure and the heart's function. This term is often used interchangeably with cardiovascular disease. So you may have been diagnosed with heart disease or cardiovascular disease. It means the same thing. And generally refers to any conditions that involve the narrowing or blocking of blood vessels that can lead to a heart attack, chest pain or angina that you may hear of, or stroke. Other heart conditions that affect your heart's muscle, the muscle heart valves, or the heart rhythm are also considered forms of heart disease. So we have some key heart disease statistics here, and these are from the 2018 Australian Bureau of Statistics. So at that time, coronary heart disease or cardiovascular disease was the leading cause of death in Australia and represented 1 in 5 of all deaths. The key risk factors that contribute to heart condition are largely preventable and include high blood pressure, high cholesterol and inactivity. Additionally, most people don't associate these key risk factors with their heart health. And 2 in 3 Australians are overweight or obese, which is among the leading risk factors for heart disease. Another fact is that nearly 3 times as many women die of heart disease compared to breast cancer. So we see a lot of publicity, which is fantastic, on the research that is being done in breast cancer for women. But there is also a lot of research going on for heart disease, but unfortunately heart disease kills a lot more than breast cancer. And in fact, every day, 22 women lose their lives to this condition. So there's a bit of a breakdown of how Australians were living with cardiovascular disease at the time. So there was about 16.6%, and of that, 0.5% were diagnosed with heart failure, 2.4% with coronary heart disease, which was the leading cause of death, and 1.6% with heart attack, and the rest made up by stroke and blood vessel disease. So these are some of the common cardiovascular conditions that we see under that umbrella term, and they include coronary heart disease, heart attack or myocardial infarction, high blood pressure or hypertension, cardiac arrest, heart failure, arrhythmia, peripheral artery disease, stroke or congenital heart disease. And we're just going to have a bit of a chat about each one of these today. So coronary heart disease, and I've included here heart attack as well, because unfortunately with coronary heart disease, it can often end up with a heart attack. So this is where we see damage or disease in the heart's major blood vessels. Symptoms of coronary heart disease may be different from person to person, even if they have the same type of condition. Often people have no symptoms and therefore do not even know they have the condition until they have chest pain, a heart attack or a sudden cardiac arrest. Coronary heart disease is often caused by the buildup of plaque, which is a waxy type substance found inside the lining of the larger coronary arteries. This buildup can sometimes partially or completely block the blood flow to the heart. And it also affects how the arteries in the heart works and may be caused by disease or injury to the vessels. So the next condition that we're going to chat about is cardiac arrest. So a cardiac arrest is a sudden, unexpected loss of heart function, loss of breathing and loss of consciousness, and is often caused by an arrhythmia. So a sudden cardiac arrest is a medical emergency and if not treated immediately will result in sudden cardiac death. A cardiac arrest occurs when your heart stops beating due to an electrical malfunction. So heart failure, this is a chronic condition in which the heart is unable to pump the required amount of blood or at a sufficient rate to match what the body needs. It is one of the most common complications of heart disease and can result from many forms of heart disease, and these include heart defects, cardiovascular disease, valvular heart disease, heart infections or cardiomyopathy. Hypertension is a condition where the force of the blood against the artery walls is too high. So usually hypertension is defined as having a blood pressure of greater than 140 over 90 and is considered severe if the pressure is above 180 over 100 to 120. It really is normal for your blood pressure to fluctuate throughout the day, and this depends on the type of activities that you're undertaking. However, having blood pressure that is measuring consistently above the recommended amount will or may result in you being diagnosed with hypertension. The higher the blood pressure levels, the more at risk you are from other health problems such as heart disease, heart attack and stroke, especially if left untreated. The problem with blood pressure is that it often presents with no symptoms. So we refer to this as asymptomatic. So many people can be walking around with and having hypertension but not realizing it. Some people say, oh, my blood pressure is a bit high because I have a headache. It's not always a correlation. Sometimes maybe, but mostly we see no symptoms. So an arrhythmia refers to the improper or uneven beating of the heart. For example, your heart may beat too fast, be beating too slow, or beating irregularly. And these arrhythmias occur when the electrical impulses to the heart are not working properly. They can be an emergency or they can be completely harmless. There may be no symptoms at all, or you may feel like your heart has skipped a beat or is fluttering in the chest. Sometimes you may feel faint or dizzy and experience some form of chest pain. So peripheral artery disease, this is where there's a circulatory condition in which the blood vessels become narrow, reducing the blood flow to your limbs. So peripheral artery or vascular disease, you may hear it either way, is a sign of fatty deposits and calcium building up on the walls of the arteries, which is referred to as atherosclerosis. So peripheral artery disease means that your arms and legs, although mostly your legs, are not receiving enough blood flow due to this blockaging. The risk factors are aging or diabetes and smoking. So one of the main and most debilitating symptoms is leg pain. And this is particularly when you're trying to walk around. So walk around the shops or at home, you will experience this extreme pain. And this is referred to as claudication. So a stroke occurs when there is a sudden interruption in the blood supply to the brain. So we can see a bit of a pattern happening here. We've got coronary artery disease and heart attack, where there is problems when there's a sudden interruption in the blood supply to the heart. And then we have peripheral artery disease, and this is where we have problems that are resulting from the interruption of blood supply to the arms and particularly the legs. And now a stroke, where there is we're at risk of having a stroke if there's a sudden interruption in the blood supply to the brain. So there are the three main types of stroke. So the first one is ischemic, and this is the most common one that we see, and it accounts for about 87% of all strokes. We could have a hemorrhage, and this is caused by bleeding into the brain tissue when a blood vessel bursts, or an aneurysm. So then we have transient ischemic attack, or a TIA. And these are usually a warning or a mini stroke, and any deficits or outcomes that you might have from the stroke usually resolve very quickly with a mini stroke. So a stroke is a medical emergency, as brain tissue does begin to die very quickly following a stroke. The risk factors that lead to cardiovascular disease can also lead to an ischemic stroke and occur when the arteries of the brain are narrowed or blocked, resulting in too little blood reaching the brain. Symptoms of stroke include trouble walking, trouble speaking or understanding what you're being asked, as well as paralysis to the face, arms or legs. Early treatment with medications can reduce or minimise the amount of brain damage. Other treatments such as exercise rehabilitation can also limit the complications and help prevent additional strokes. So congenital heart disease, so this is an abnormality in the heart that develops before birth. It is one of the most common types of birth defects that we see in young babies or children. Symptoms include abnormal heart rhythms, blue-tinted skin, some shortness of breath, failure to feed or develop normally, swollen body tissues or organs. Treatment can include medication to lower blood pressure and heart rate. We may have some heart devices such as pacemakers, catheter procedures or surgery, and then really serious cases may result in a heart transplant. So we have some different risk factors that expose us to the risk of developing heart disease. And the first one here is age. So age the risk increase significantly as we get older. And what occurs is that we see some damage and narrowing to the arteries, as well as resulting in a weakened or thickened heart muscle. The sex or gender, so males are at greater risk of heart disease, however women's risk increases significantly post-menopause. So family history, so if you have a dad or a brother who has been diagnosed with heart disease below the age of 55, or a mum or a sister who's been diagnosed with heart disease below the age of 65, you accumulate one of these risk factors without having done anything. So these first three risk factors are what we term as non-modifiable. So we can't change our age. I wish we could. I'd be putting my hand up for it. And we can't generally change our gender, and we can't change our family history. But the rest of the ones that we're talking about now are what we refer to as modifiable. So we can make an impact on these ones. We can change these. So we know that smoking, nicotine constricts your blood vessels, and also carbon monoxide can damage their inner lining, making them much more susceptible to atherosclerosis. Heart attacks are much more common in smokers than they are in non-smokers. Unfortunately, there are certain chemotherapy drugs and radiation therapy for cancer that can result in or increase our risk of developing heart disease. It's hard to know what we can do about these. The drugs are improving. We used to sort of seeing these in the previous decades, but we're seeing less and less now. But these drugs are designed to kill the rogue cancer cells, and unfortunately they can kill some healthy cells as well, and so we can end up being diagnosed with some form of heart disease. Our diet, so a poor diet, so a diet that's high in fat, salt and sugar and cholesterol can contribute to the development of heart disease. Now these guidelines are from the Australian Heart Foundation guidelines, but what is emerging lately is we are seeing some evidence that fat may not be the bad guy that he has been thought of for a long time. Now, a lot of this information is outside my scope of practice, but at HFRC, we're very fortunate to have a metabolic health expert. So if you'd like to find out more about the impact or non-impact that fat has, I'd really highly recommend you giving the clinic a call and having a chat with David, my colleague. So high blood pressure, we also know that uncontrolled high blood pressure, as we said, can result in hardening and thickening of your the arteries, narrowing the vessels through which that blood flows. High blood cholesterol levels, so these can increase the risk of formations of plaque and that atherosclerosis. With diabetes, heart disease and diabetes share very similar risk factors, and these include obesity and high blood pressure. Obesity, so this is, excess weight typically worsens all of the other risk factors as well, and as does physical inactivity. So lack of physical activity is associated with many forms of heart disease and some of the other risk factors as well. The stress is a bit of an underrated risk factor, but it's certainly gaining more and more support as being a major contributor to heart disease. And we know that it can damage your arteries and worsen other risk factors for heart disease. And poor hygiene. So as we've seen with COVID, making sure that we're washing our hands regularly and establishing really good healthy habits can help prevent any viral or bacterial infections that can put your heart at risk of an infection. This also goes for dental health, so making sure that we're brushing our teeth regularly, using dental floss and seeing a dentist can really help reduce the risk of developing any of those infections that can impact on the heart. So how do we obtain and maintain a healthy heart? Good question. So we know that keeping your heart healthy, whatever your age, is the most important thing that you can do to help prevent or to manage that heart disease. We know that by improving your lifestyle, including your diet and level of fitness, can help minimise your risk of developing this condition. And also, even if you have 2 or more of those risk factors, if you make some of those changes, you can reduce your chances of developing this condition. So you may have those, what we refer to as non-modifiable risk factors, but if you make changes to the modifiable ones, you can sort of counterbalance some of that risk. So we know that prevention is always far better than the cure. So by making some of these lifestyle changes, they really improve our chances of living a healthy life and preventing that damage being done to our heart. So we know we can quit smoking. We know that we can control other health conditions such as high blood pressure, high cholesterol and diabetes. We can try to exercise for at least 30 minutes a day on most days of the week. We can eat this diet that's low in salt and saturated fat. This is where the question is at the moment. And we can maintain a healthy weight. We can reduce and manage our stress, and we can practice good hygiene. So there are certain types of diseases, however, that we can't prevent, and these are ones that are caused by heart defects, but the rest we can have a huge impact on. So we know that your heart affects every part of your body. This also means that diet, lifestyle, and your emotional well-being can affect your heart. Emotional and physical health are both important for maintaining a healthy heart. So how do we move forward? So people with heart disease need regular physical activity as much as anyone else. Studies have shown that people who begin to engage in regular physical activity and make other healthy changes after a heart attack live longer and have a much better quality of life than those who don't. Without regular physical activity, the body slowly loses its strength and ability to function well. So what is physical activity? Okay, so this is a really broad term that covers any activity that moves your body and speeds up your breathing and your heartbeat. So this can include things like raking the leaves, doing some gardening, climbing stairs, walking or playing sports. It also includes exercise. Now, exercise is slightly different in that it is a structured physical activity that aims to improve health and fitness and is regular, planned and consistent. So structured physical exercise is really important, but you can also add some other physical activity to your day. And this is what we call incidental physical activity. And these can include, like I said before, raking the leaves or gardening, household chores, playing with your children or your grandchildren or your pets, and choosing to walk up those stairs instead of taking the elevator. Or just parking that little bit further away from the shops or from the doctor's appointment, wherever you're going, just so that you can increase your steps per day. So there's lots of different types of exercise, but they're basically broken down into 4 different groups. So we have aerobic exercise, and this is where we use the large muscle groups, and things like swimming, cycling, rowing, running or jogging come under this umbrella, and these are where they've caused your heart rate to rise. And this increases your capacity to use oxygen, which improves your heart and your lung fitness. We have strength training. So anything, we can be using dumbbells, we could be using TheraBands, we could use stretchy bands, we can do your baked bean tins in your cupboard, and anything that causes the muscles to contract against an external resistance, with the expectation that we're going to see some increases in strength, tone and endurance. And these are very important as we age. So we know that balance exercises are equally as important, and we want to prevent that risk of falling, as well as flexibility exercises. And all these exercise, different groups or types of exercise, are there to help you remain active and independent, which is so vital as we get older. It can also help offset some of the effects of aging and help ensure a greater quality of life. So we have some various different physical activity guidelines, and this depends from children through to our senior adults. But some of the take-home points from these physical activity guidelines is that anything is better than nothing, particularly if you're not doing any activity at the moment. We know that even if we start off small and build, we're going to see some benefits. We want you to try to be active on most, preferably 5 or more days a week, and aim to achieve at least 30 minutes of moderate intensity physical activity. So moderate intensity, that sounds scary. What does that mean? Well, generally that means if we're going for a walk, maybe we include some hills if we can, or some steps. We just want to get that heart rate up a little bit so that we're starting to get a little bit sweaty and a little bit short of breath, but we could still hold a conversation if we needed to. If we get to a stage where we're really puffing and we can't hold a conversation, we're exercising at too high of an intensity, and we don't need to be at that intensity to see the benefits from exercise. So we want to aim to do at least 2 muscle strengthening activities in a week, and now we don't want to be encouraging you to do these back to back. We'd like a few days in between to allow those muscles time to rest and recover, and this is where we see that adaptation, where we see those strength training changes to our muscle. We want to perform all activities in bouts of at least 10 minutes. So achieving at least 30 minutes of moderate intensity can be seen quite daunting, particularly if we're starting off new. So maybe looking at doing 3 bouts of 10 minutes or at least 10 minutes of activities over the day, it will feel like it's more achievable. So I would often tell my clients that maybe after breakfast, go for a good 10-minute walk. After lunch, go for another good 10-minute walk, and then before or after dinner, maybe another one. And those 3 10-minute sessions all add up to those 30 minutes, and they're as equally of benefit as completing 30 minutes at the same time. Another big take-home point here is that it's really vital that we break up our long periods of sitting. So I've known many clients, or family members as well, who are very busy in the morning. They will go out, they'll have coffee, they'll meet with their friends, they will do their household chores, they'll do their washing, they'll go to the shops to get their food for the day. They might play some tennis. They'll be active in the morning. They'll come home, they'll have lunch, then they'll sit on the couch or the recliner chair, watch the TV movie, maybe rest their eyes for a few minutes and take up some knitting, do whatever, and the next it's time to start getting ready to cook dinner. And so without even realising it, they've sat for maybe 4 hours or more without moving significantly. And this is where we're seeing a lot of impact on our health at the moment. So the recommendations is maybe to get up every hour on the hour for about 5 minutes. Just go for a walk around the house, go out to the letterbox a few times or around the clothesline, anything that just gets that body moving for those 5 minutes before you, and repeating that throughout the time that you're sitting. So why should we exercise? Well, we know that with exercise, this is well proven now, that there are many, many benefits for your physical and mental well-being. We know that exercise can improve your physical function. This makes what you want to do on a day-to-day basis so much easier. We know that we can reduce blood pressure. We can develop stronger muscles and bones and reduce down that effect of aging. And stronger muscles and bones help those activities that we want to do. It makes them so much easier to do. We can improve circulation. We can achieve or help maintain a really healthy weight. We can boost your energy levels, improve your mobility and balance. We can help cope with your stress, anxiety, and depression, make you feel better about yourself and life, improve your quality of sleep, and more importantly, reduce the time it takes to fall asleep, improve memory, and reduce the risk of developing dementia or any other cognitive conditions. But it can be really scary and it can be hard to know where to start, how much exercise to undertake, for how often and for how long. But what we don't want is we don't want this fear or uncertainty to stop you. This is what we are here for. So we know that cardiac rehabilitation is a medically supervised program that is designed to improve your cardiovascular health if you've experienced any of these conditions that we've been talking about today. It has 3 equal parts. So we have this exercise counselling and training, and this is where we teach you how to undertake or complete the exercises that are going to get your heart pumping and improve your entire cardiovascular system. And also to promote ways to improve your heart health. We're going to provide you some education on heart healthy living. So this might be some guidelines to help you quit smoking or to make some heart healthy nutritional choices. Now, so we're not clinical psychologists or psychiatrists. We can provide some counselling to help you acknowledge and recognise your stress levels and to find ways to reduce that on a day-to-day basis. So why a supervised program? So someone who has had a heart scare or is told that their heart is at risk can often be fearful of exercising. And what I've seen a lot is it's just the patient, it's also their family. Their loved one has just had a really big scare and they don't want them to be putting themselves at risk of having another event. They want to wrap them up in cotton wool and keep them as safe as possible. And we fully understand that. Like I said, it's very normal, but sadly it stops many from doing the exact thing that can actually help save their lives, reduce their risk, and help lead a full and active life. So a properly designed exercise program not only strengthens your heart, but it also improves the rest of your body, especially your muscles, and this really helps your heart complete the work that it has to do. So cardiac rehabilitation may not change your past, but it can definitely help improve your heart's future. So at HFRC, we have our Heart Health and Diabetes Care Program. And this is a supervised exercise program for people who have experienced a cardiac event, live with a known cardiac condition, or have these cardiovascular risk factors that we've been talking about. Clients are assessed before and after each session and closely monitored whilst exercising. The program is supervised by accredited exercise physiologists who have studied at university for over 4 years and have learned how to design safe and effective exercise interventions for people with health conditions. So the fitter and healthier you are, the less stress you put on your heart. It's never too late to start living an active lifestyle. And whilst activity may not add years to your life, although it might, it will certainly add life to your years. And whilst we can't turn back the clock, we can definitely wind it up a little bit. So we have a few links to some other programs here at HFRC. And as I mentioned before, our metabolic health specialist, he works closely with our heart health team to ensure we are giving you the best advice and support to improve all aspects of your health. And we also have some other team of exercise physiologists, physiotherapists and remedial massage therapists. And they look at helping you to overcome musculoskeletal pain and improve your physical function and allow you to move more freely with less pain and certainly faster. So that's it for me today. So thank you so much for attending today's seminar. And please, if anyone has any questions, please email on our email address and I'll be very happy to respond to you as soon as I can. So thank you very much. Bye.